Garcia, and I will be presenting on Chapter 6, Family Violence. Throughout this course, you will learn how to differentiate myths from the reality of family violence, outline the extent of family violence in U.S. society, explain the social factors associated with marital rape, analyze the causes of behaviors associated with wife abuse, describe the social factors related to child abuse, identify risk factors for elder abuse, describe social profile of family abusers, the impact of feminism on family violence, compare positivist theories on family violence, and evaluate family violence protection in the United States. Myths about family violence. The first myth is family violence hits the poor only. This is not true. Higher rates of family violence are amongst lower income people. Renzetti and Larkin state that in economically distressed families, violence victimization tends to make it more difficult for women to maintain employment, thus exacerbating economic distress. We see the results of violence more often among poor women. Women further up in the economic ladder may have resources to keep victimization hidden. There are 5 times as much marital violence in families at or below the poverty level as in families above the poverty level. This does not necessarily mean that most, let alone all, poor families are violent. Only a minority of poor families are violent. Myth 2. Violence and love cannot happen together. Parents often resort to violence to discipline their children. Couples with one partner battering another stay together for about the same length of time as the average marriage, which is about 6 years. Women stay in abusive relationships because their partners express love. They hope that change will happen within their partner. Myth 3. Most abused children grow up to be abusive parents. Actually, the majority of child abuse victims do not grow up to abuse their children. And lastly, myth 4. Alcohol and drugs are involved in most family violence. Users of alcohol and drugs are more likely than non-users to get involved in family violence. Male binge drinkers who abuse their wives are 3 times higher than that of non-drinkers. This doesn't necessarily mean that drug and alcohol are the cause of violence. The real cause is personal problems. The next objective is the extent of family violence. Marital rape, women abuse, child abuse, and elder abuse fall under the extent of family violence. Extent of family violence varies from one research report to another. There are 2 definitions. The first one is broad, that defines to include spanking, slapping, cursing, threatening, or to send a child away. 85% of U.S. parents would be found to be abusers if we always used broad definition. The second definition, narrow definition, states that physical violence such as punching, kicking, hitting, or throwing the child down are abuse. That would mean that only about 5% of U.S. parents would be found to be abusers. The definition problems, counting problems, and hidden cases make all estimates difficult. People are generally reluctant to reveal their family problems to researchers. If financial exploitation is included in the definition of elder abuse, there is a much greater percentage of older people as victims. The next objective is marital rape. Most prevalent form of forced sex. Diana Russell ran a research and concluded that 14% of married women had been raped by their husbands. The CDC ran a national survey and stated that 9.4% of married women were raped by their husbands. So what is the nature of marital rape? It involves physical violence or the threat of it by husbands against wives. Majority of marital rapes do not involve vaginal penetration. They involve anal intercourse, inserting objects, forcing the wife to have sex in front of the children, first sex after giving birth. Offenders assume that they have entitlement to have sex with their wives. The victims who are employed can become economically independent and might get a divorce. Unfortunately, those who are not employed tend to stay married. So what are the causes of marital rape? We can assume that there are 3 causes. The first is the sexist belief that husbands are entitled to have sex in any way they want with their wives. This is a patriarchal myth that wives cannot be raped because they are considered as belongings to their husbands. All 50 states have made marital rape a crime, but it is rare for a married man to be charged with raping a wife. The second cause is husband's attempt to punish the wife for what he considers unfaithfulness or any perceived sin, such as not washing the dishes on time. Husband attempts to rape as a form of control over their wives. Deserexy and Schwartz call this black male rapes. An integral part of the patriarchy society encourages men to dominate women. The more strongly a husband believes in the patriarchy, the more likely he is to rape his wife. Because he has the entitlement of sex, a punishment for her sin, control over her. The same culture that justifies marital rape also encourages the victim to blame herself. The next objective we'll be learning about is wife beating. By lumping together violent and non-violent acts, the researchers argued that wives are as likely, if not more likely, than husbands to be offenders. 1/3 of all U.S. married persons assault their spouses every year. 2/3 do so at least once during their marriage. To avoid trivializing, they focus on really violent acts, serious enough to cause injury. More likely to happen to women at their husbands' expense, at the hands of their husbands. The CDC National Intimate Partner and Sexual Violence Survey concluded that 35.6% of American women reported at least one instance of physical violence. So what is the nature of woman abuse? Martin Schwartz considers wife beating to be considered a serious and social problem. Barnett, Miller-Perrin state that abused husbands often attempt to neutralize or rationalize their violent act in one of 3 ways. The first one is blaming the victim for provoking the offense. Second is to minimize the harm done to the victim. Third is attributing the violence to some problem beyond their control. Women develop PTSD, which is a feeling of depression, anxiety, and helplessness. Women with this disorder develop battered women syndrome, which is a specific pattern of losing self-esteem, feeling trapped and expecting constantly the terror of violence, but eventually striking back and killing their husband. So, why don't some battered wives leave? Women who leave seek help or refuge from police, social workers, mental health agencies, and shelters. And friends, women are prevented from leaving by major threats, sexual assaults, threats to their children. These are some of the most socially and economically isolated women. Economic dependent on their husbands, fear of retaliation, and fear of being reduced to poverty are also some of the reasons they do not leave. So, what are some of the causes of women abuse? Feminist theories state that a major cause of wife beating is the sexist, patriarchal nature of society, which treats women as property. Recent arrest laws are not decreasing incidents of repeat battering, but more spouses are getting arrested. Husbands who hold patriarchal beliefs are more likely to assault their wives. Those who have lost their jobs, control of their lives to poverty, drug use, or alcoholism. Poor or unemployed men are more likely to beat their wives, especially if the wives are employed. Their work represents a threat to their husband's power and control. Next, we looked at objective number 5, child abuse. Child abuse is considered a national emergency. Child abuse includes sexual abuse, physical abuse, psychological abuse. RAINN, Rape, Abuse, and Incest National Network, state that incest is an inhibitionism, sharing pornographic images, sending obscene text messages or phone calls, and other events that do not involve physical contact. Physical abuse state that serious is the serious beating that can break bones or cause medical emergencies. Other researchers define all spanking or physical discipline as abuse. So, what is the nature of child abuse? So, incest is the abuse at the hands of family members. Sexual abuse is underreported. 1.9% of all boys in the U.S. have been sexually abused. Finkel or et al. States that girls ages 15 and 17 are at the highest risk. At least 10% of all American girls are sexually victimized or assaulted between the ages of 15 and 17. Sibling sexual abuse is more common. No significant difference in rates among social classes, racial or ethnic groups. Incest gives a rise to strong sense of shame and guilt, as well as anxiety, depression, and isolation. Large number of children who die in the U.S. each year is from maltreatment and physical abuse. This results from the lack of social services and a safety net in the U.S. Abuse comes from older siblings and parents. 4% of all children under the age of 17 years are severely assaulted. And to this, the U.S. enacted the 1974 Children Abuse Prevention and Treatment Act. This law requires professionals, healthcare workers, law enforcement officers, teachers, and social administrations to report child abuse to the appropriate child protection agency. This encouraged child protection agencies to over-report, because the more people they reported as child abusers, the more money they received. Researchers argue that children under 5 are at a higher risk than older children for being abused because they are more dependent and powerless. Epidemiologists argue that the greatest abuse is among children aged 12 to 14. Child abuse occurs more frequently in lower income families. Children abusers are more likely to have emotional, behavioral, and familial or interpersonal problems such as marital problems, isolation from friends and relatives, low self-esteem, depression, being quick to anger, and lose control. Children who have been abused are more likely to experience many social and psychological problems, such as emotional and social difficulties, learning disabilities and poor economic performance, running away from home, delinquency, criminality, and violent behavior. When they become adults, they are more likely to abuse drugs and alcohol, engage in criminal activities, suffer from psychiatric disturbances, and become child abusers themselves. So, what causes child abuse? The intergenerational transmission of violence states that the participants or children are more likely to abuse their children if they have learned in childhood that it is okay to use violence in dealing with child rearing problems. This learning comes from the experience of being abused as children. But the majority, 70% of abuse victims, do not grow up to become abusers. The legitimacy of using violence to deal with problems. Parents observed as children how their parents and other significant adults used violence to express anger. Child abusers are more likely than non-abusers to have been raised in homes with a great deal of marital conflict and violence. Acceptance of the popular view that physical violence is a proper way of disciplining children. Half of U.S. parents resort to physical punishment to correct a child's misbehavior. Social acceptance of physical punishment. Child abuses tends to see their abused behavior as good and proper. Poverty, unemployment, family problems, and lack of education are also a cause of child abuse. Problematic interaction between parent and child. This significantly increases the risk of child abuse. Parents' problems include lack of parenting skills, scarcity of knowledge about normal child behavior, unrealistic expectations for the child, and punitive parenting. Child problems include antisocial behavior, aggressive behavior, and mental and physical disabilities. Female genital mutilation involves cutting off some of the female genitalia, such as the clitoris, foreskin, or labia. This usually is performed on girls ages 4 to 14. And performers are ritual leaders that are well-respected elderly women in the community who are specially designed for this task. In some areas, trained medical doctors perform the procedure. This has been considered one of the worst human rights violations against the female gender. The result are physical problems like death, hemorrhage, infection, and severe pain. There are also psychological problems, anxiety, depression, low self-esteem, and recurring memories of the mutilation, and sexual problems. Women unable to experience sexual pleasure and orgasm, and their husbands choose to have sex with an uncircumcised woman. The UN passed a resolution condemning the practice. So what are some specific reasons why the practice takes place only in some patriarchal societies? One is the cultural belief that genital mutilation makes women more desirable. Clitoris and labia are seen as masculine and unsightly on a woman, so they are removed so that genitalia will look highly feminine and aesthetically pleasing. It can be viewed as cosmetic surgery. Second, virginity and marriageability hold a high social value. If a woman is not circumcised, men will suspect that she is not a virgin and would not like to and would not think of marrying her. Female circumcision is taken as proof of virginity. Patriarchal line of thinking that requires virginity proof amongst girls and not boys. And third, the reward of social and psychological benefits. Helps women become accepted among her peers as well as the entire community of women. The experience of bravery going under the knife and in the presence of other women may enable the participant to feel strong and powerful. A party is given to the participant, and many friends, family, relatives, and neighbors will come to offer congratulations. Societies that engage in its attempt to paint the practice as positive and try to reward the victim for undergoing the abuse. Elder abuse. The majority of people can take care of themselves. A significant minority have difficulty doing so. 25% of elders require long-term care. Some of these elder dependents suffer from abuse at the hands of their caretakers. So what is the nature of elder abuse? It appears in the form of neglect, emotional abuse, financial exploitation, and physical abuse. Neglect is defined as that the elder has some important needs that are not being met. Roughly 10% of all elderly persons over 60 in the U.S. suffered in the past year from one of these types of abuses, including sexual abuse. Perpetrators are often adult children. Older men are more likely to be abused. This is because they socially isolate with relatives, have few contacts with friends, and relatives other than the caregiver, and do not connect with relatives other than the caregiver. There are no class differences in rates of elder abuse. Financial exploitation is a form of elder abuse that has to do with greed, and it is committed by the elder's own family. Abused elders suffer from a variety of psychological problems, especially depression and sleep disorders. There is not enough research that has been done to provide more detailed data on the consequences of elder abuse. So, what are some of the causes of elder abuse? We have the sandwich generation, which is the middle-aged group squeezed between raising children and taking care of their parents. Others are on the daughter track, taking care of older parents with chronic and disabling conditions. Older abusers are distinguishable for having severe personal problems, such as alcoholism, drug addiction, unemployment, antisocial behavior, arrest records, and emotionally unstable. Help users are usually beset with money problems or financially dependent on their victims. Male and females can be abusers. Older persons themselves are more likely to abuse their spouses than to be abused by their children. Women who are financially and problem-free are less likely to abuse their parents because they have been socialized to take family responsibilities more serious than men. Elder abuse arises from problems that flag caregivers, such as stress, severe personal problems, financial difficulty, and dependence. The social exchange theory states that the cost of caregiving exceeds the benefit of the caregiver expects to receive. This is a social exchange between the giver and the recipient of elder care, differs from economic exchange. Benefits that provider of elder care often receive are emotional or even spiritual in nature. Another benefit is the caregiver's expectation of receiving aid in the future when they become old and dependent themselves. A social profile of family abusers. There is enough data to suggest that the average of abusers in the US family are like: age. Young husbands and parents under 30 are more likely to assault wives and abuse children. Class. Family violence cuts across all income levels. It occurs more often among lower income families and more frequently among individuals without a college degree. Lower class people have less ability, resources, or opportunities to demonstrate personal power outside their home. So lower class men are more likely to abuse their wives and lower class women their children. Gender. Men are more likely than women to inflict serious injury to their victim. Physical abuse in children. Women are more likely to be the offenders. This is because women spend more time with their children. In families where the men have more responsibility for childcare, they are more likely to be abusive. A stressful life. People with more stress in their lives are more likely to commit family violence. Stressful life includes having financial problems, being pregnant, being a teenage mother, being single parent, and having sexual difficulties. Social isolation. Those who are socially isolated are more likely to commit family violence. A global perspective on family violence. It is a worldwide phenomenon, occurs more frequently in developed countries, and the nature of violence involves physical, sexual, and emotional abuse. Help in the U.S. is more accessible to victims in U.S. and other affluent societies. This is due to the feminist movement 40 years striven to end violence against women. Since the 1990s, poor countries have started to protect women against violence by men. In 2007, Russia Parliament voted to decriminalize domestic violence. The church claims that allowing men to beat women was essential for preserving the family, which then created a safe atmosphere for women. In South Africa and Uganda, it is the custom of paying a dowry for the bride, which reinforces traditional beliefs that women are property. In Cambodia, women who discussed family issues with patriarchal husbands were often beaten. Reform in the U.S. has made family violence less common. But American women are more likely than their counterparts in poor countries to abuse their husbands. Husband abuse represents in effect a resistance to the patriarchy. Theories of family violence. Social learning theory states that people are likely to engage in family violence if they have been exposed to violence. Individual learns that violence is the appropriate way to deal with interpersonal problems, and is given this kind of learning, they all tend to commit violence against the other person in the family. Stress theory. Those who lack the resources and social support are more likely than others to buckle under stress. They might commit violence against a family member. Exchange theory. Based on the principle of benefit and cost, reward and punishment. They are practical or instrumental values to violence. People you harm or intimidate proceed to act in accordance with your wishes afterwards. It does not apply to all families, though. This theory needs to include psychic rewards, and punishment. If you define violence as strong and refrain from engaging in it, even when there are benefits of being violent. Social responsibilities to family violence. Protecting women against strangers is easier than protecting against family members. All states have passed laws against marital rape laws and barely enforced. Many wives cannot get help from community because no one wants to intervene in private matters. Some women can find protection as battered women. Victim services are amongst the first to be cut in financial crisis. In the late 1980s, more than half of the states required or encouraged the arrest of perpetrators. There has been little evidence that arrest is effective in reducing violence. In the 1970s, battered women can obtain a civil order of protection. This forbids contact between the victim and offender. Offenders can become more violent toward the victim, unfortunately, and stalkers rarely are deterred by a protection of order. Battered women can seek protection by going to a shelter or a safe house. They receive physical protection and social support as well as counseling, legal aid, or occupational counseling. Occupational counseling provides the most useful assistance because it helps the victim obtain employment. The job ends her social and economic dependence on him. State-implemented programs require abusers to participate in a counseling programs, some known as BIP, Batterer Intervention Programs. Some women may stop calling the police because these programs are not really effective. Only a minority of wife beaters are mandated to complete the programs, and batterers who volunteer to complete the program usually drop out. Protecting children. In the mid-1970s, every state passed mandated reporting laws that made reports to CPS, Child Protective Services. When CPS determines abuse, they do two things. They provide the family with social support, counseling, daycare services, and food stamps. If parents are dangerous, they remove the child from the parents and place the child in a foster home, care of relatives, or residential treatment center. About 75% of the children are placed in foster care. Some children are killed after abuse is reported to CPS. This is because CPS agency is understaffed and overworked. Some reports remain uninvestigated. The risks of removing children from parents. The first is that children don't understand what is happening and may think that they are being punished. The second is that mistreated children require special care. Foster care parents fail to provide the proper care. Child advocacy groups criticize CPS for failing to adequately protect abuse victims, either in their home or out of it. Protecting elders. There are no formal government protective service agency, but all states have some type of elder protection program. Most states have mandatory elder reporting laws. Such laws demean elders by treating them like children with negative consequences. And also this sometimes, because abused elders do not want to be treated like children, they self-neglect. This means that elderly refuse care or help when they need it. Social service departments provide a wide spectrum of services to abused elders. such as homemaker assistance, legal services, medical care, counseling, housing, or relocation. There are two types of services that are most used: medical services, which is doctors, nurses, physical therapists, and community health nurses. The second are legal services that help in obtaining restraining orders to remove abusers, provide guardianship of elders and their estates, safeguarding elder, social security benefits, and other income against involuntary commitment. Thank you.